Good afternoon. Welcome to Asia Society Hong Kong Center. My name is Alice Mong, Executive Director of Asia Society Hong Kong Center. I'm delighted that Asia Society Hong Kong Center can bring you our first episode one conversation with Professor Benjamin Cowling. We will be talking about coronavirus updates, facts from Hong Kong and beyond. And we're really delighted that our first guest for this series, we are hoping to make it a weekly series, is Professor Benjamin Cowling, Head of Division of Epidemiology and Biostatistics at the University of Hong Kong School of Public Health. And he has been there since 2004. And Professor Cowling is also a co-director of the WHO Collaborating Center for Infectious Disease, Epidemiology, and Control at HKU SPH. And it is really a delight for us to present Professor Cowling our first of a series of updates. And the reason for us to present this program is really to present you some of the facts rather than some of the fiction. And we really feel Asia Society Hong Kong is the ideal place to bring you this regular update straight from Hong Kong. And we hope you will tune in regularly. But right now, it's my pleasure to turn it over to Professor Cowling to tell us some of the updates as of February 14th, 2020.
Yeah, thanks very much. This is great to be here. My first time coming to Asia Society Hong Kong. I'll start with I'll say some of the things that we know so far, and then I guess in the coming hour I'll also have to explain there's quite a number of things we don't really know so far. So what we know to start with is that at some point before the middle of December 2019, a coronavirus jumped from bats into humans, perhaps through another animal in a wet market. That's the most likely explanation at the moment. And then that coronavirus has been able to transmit in humans, initially in Wuhan, and then subsequently spreading across other parts of China and outside of China as well. What we know in the earliest stage of the outbreak in Wuhan, probably the end of December and early January, each infected person on average was spreading to 2 more people. It was a relatively slow cycle, maybe every week, so that one week there might be a handful of cases, the next week there may be twice as many, and then twice as many the week after that. So it's slowly growing, but we know that by the middle of January, there's most likely 1,000 or more infections in Wuhan. And then at that point, in the middle of January, we started to identify infections in other parts of Asia, the first in Bangkok and then in Tokyo and then in quite a number of other places. The Chinese government made a number of quite careful responses to the outbreak in Wuhan. And one of them was actually the quarantine of the whole city of Wuhan and some other cities in the area. And that had the effect of stopping further exportation of infected persons from Wuhan to other countries. But we've seen still in the past week, there's been a number of infections identified in Hong Kong and also Singapore. There's not yet evidence that there's ongoing sustained transmission in any of these places. But one of our concerns is to what extent are there infections that haven't been identified in Hong Kong, Singapore, and other parts of Asia, or in the wider world. I guess we're going to have to keep a very close eye on the pattern of infections as the next weeks go by.
I think you were interviewed in Time magazine on February 4th, and you had mentioned February 3rd to 9th was a critical week to assess how well China's containment strategy has fared. And so I'm just curious, your assessment, is the 3rd and 9th are still the dates? I mean, and what should we be paying attention to, other measures in the coming weeks?
So towards the end of January, the city of Wuhan and some other cities were placed under quarantine with a cordon sanitaire around those cities to stop any people from entering or leaving those cities. And the intended effect of that was to reduce or even prevent cases of infection being identified outside of China. We saw there was a very clear effect of that intervention, and the numbers of exported cases did decline, but they haven't dried up to zero. We've still seen some exported case identified in other countries, even in the past few days, but not infected from the cities that are under quarantine, infected elsewhere, including some people infected in Thailand who've then traveled elsewhere, some people infected in Singapore who've then traveled elsewhere. So originally, the intention of the cordon sanitaire was to contain all of the infections within Wuhan, but it seemed like some infections had already occurred outside of that. And so, containment has not occurred. Containment has not occurred.
So yes, 2 days ago, the numbers apparently spiked because of a new diagnostic. So can you kind of explain about that? Because it, obviously when the news came out, sent some panic around the world. But can you, in your expert opinion, explain about that spike?
Got it. So in epidemics like this, we'll often think of categories of cases because that can guide the monitoring of how an epidemic progresses, and it can also give information to doctors about how to handle different kinds of patients. So the loosest case definition, the most broad, is a suspected case. And that may be someone with a fever, maybe who's had a contact with another confirmed case. So we think they may have the coronavirus infection. We're not sure. We suspect it. So they're called a suspected case. More strict than that is a probable case. And we use this terminology for someone who's not only seems like they're suspected to have it, but almost certainly does have it. So, for example, a close contact of another coronavirus case who develops viral pneumonia. There's very few explanations for that to happen, except for they've got coronavirus infection. And so we'll often track probable cases. And in SARS, the numbers that you would have heard about, the number of SARS infections in Hong Kong, in China, all of those, it's all probable cases. And then for some probable cases, we'll use a laboratory test to confirm that they really do have the coronavirus. And so the laboratory confirmed cases tend to be a subset of all of the probable cases. And the numbers of lab confirmed cases can actually vary depending on how much laboratory testing is available. In the past few weeks, we've seen numbers jump when laboratory tests are made more widely available, or when the criteria for using the test is broadened. We've also seen perhaps the evidence of caps on laboratory testing, where if a particular hospital can only do 50 tests per day, then they will only have a maximum of 50 confirmed cases in the hospital on that day, because that's the ceiling for laboratory testing. But for probable cases, the number isn't constrained in the same way. So actually, it's really a good move by the Chinese health authorities in Hubei province to expand and to report the probable cases, because it's going to give us over time a better picture of the course of the epidemic. And I guess in the rest of China, they may also begin reporting probable cases, maybe in addition to the laboratory confirmed cases.
So it sounds like we have more information to work from.
Right, exactly.
I think one of the questions, now I would like to talk about Hong Kong. There's a worry that Hong Kong may be experiencing a community outbreak. My understanding is we are currently in a containment stage of the outbreak. What are the kind of the transmission patterns that you are seeing? And what do you think can be done to curb a possible community outbreak if things get worse?
Okay, so at this stage, there's two different types or classes of strategies that could be employed to protect Hong Kong. The first type of strategies are containment strategies, where really the objective is to stop any infected persons from coming into Hong Kong. And if they do, then to identify them, place them in isolation so they're unable to spread infection. And perhaps even if they have close contacts, family members, to ask those close contacts to quarantine themselves in their home as much as possible, so that we minimize the chance, maybe not eliminate completely, but minimize the chance that there's ongoing spread of infection from those people. One of the limitations of the containment strategies like this is that we may not be able to identify every single infected person when they come across the border or when they fly in, because some people may have been infected and not show any symptoms. So it's kind of difficult, but that's one type of strategy. The other type of strategy is a separate group of interventions that aim to slow down transmission, or to throw water on the fire, if you like. So just try and keep transmission as low as possible. One example of that is school closures. And then, of course, we've seen lots of people wearing masks on the street. We've seen many people working at home. There's cancellation of church services and other religious activities, and reductions in mass gatherings of people. So all these measures are not intended specifically to identify or contain infections in people who are known to have the virus. They're more broad community level interventions that if there was an infected person who maybe didn't recognize they were infected, that they wouldn't have as much chance to to transmit onwards, and then we can kind of avoid silent transmission in the community. So those measures are effective at the moment, and my impression from looking at all of the data over the past couple of weeks is that they're working. So we are able to prevent community transmission with those measures for as long as they're in place.
I see. And currently, we only have about the latest counts 53 in Hong Kong and 1 death.
Yep.
And one of the questions I'm also curious in looking at some of the numbers that I read up in SCMP, which is keeping track of these numbers. Currently, we're seeing quite a number of cases in Japan, 251, and also they just reported a death. And then Singapore is 58. And I had also, can you kind of explain those numbers? Why Japan and Singapore are higher than Hong Kong?
So Japan's got a lot of cases from one single, probably super spreading event on a cruise ship, where there were a lot of passengers on the cruise ship, and then there seemed to be more than 200 infections among those, maybe 2,000 passengers on the cruise ship. Apart from that, the numbers in Hong Kong, Singapore, and Japan are roughly the same. And I think it reflects where we've had relatively similar numbers of maybe infections imported from people in China or from mainland China. We've been able to identify those, and we've also picked up some cases in the community. We don't know exactly how they got infected, but we've picked those up and identified small clusters. But certainly those numbers haven't been rising fast. There's just a few from day to day. There's no sign that there's an increasing rate of those kind of infections being detected.
But there has been maybe, then I'm just for those watching on Facebook Live, you have an opportunity to send in your questions, and Professor Cowling has agreed to answer as much as possible. If not on Facebook Live, we'll answer it by email or by other means later. So please, I encourage those of you who are watching, and it's I'm feeling better already, I have to say, because like many of the people living in Hong Kong right now, there's just so many untruth out there, and I just don't know what to believe. And but I was not here 17 years ago doing SARS, like some of my colleagues, and I believe you were not here either, but you arrived shortly after SARS, and you had studied SARS extensively. So here in Hong Kong, I think we are very much touched by the painful memory of SARS from 17 years ago. And a lot of people are comparing this current virus to what happened with SARS in 2003. In the medical profession, can you talk about the comparisons? Is it fair? And do you see, is there improvement in the handling of the current situation? And also, what lessons have we learned from that, from 2003?
Yeah. So SARS emerged probably into humans in late 2002 and spread for a number of months in China before it came to Hong Kong. And we really only learned a lot about SARS after it came to Hong Kong and a few other countries. In the early stages, it was really a big concern because we didn't exactly know what the pathogen was, how it was spreading, and how best to control it. But within probably a month of the outbreak starting in Hong Kong, scientists that were here figured out that if you can identify the patients as quickly as possible and isolate them and protect the healthcare workers with the right kind of protection, then you can really stop the onward spread. And then eventually the numbers just go down to zero. For SARS, it had two particular properties, which I want to contrast with the new coronavirus. So for SARS, almost every infection was severe. That means almost everybody that we know was infected with SARS coronavirus, everybody that we know about infected with SARS coronavirus had more severe disease, mostly pneumonia, requiring hospitalization. So we could identify them and then isolate them. And the second property of SARS is that patients were infectious probably 3 to 7 days after onset of symptoms, which is the time when they were in the hospital, most likely in the isolation room in the hospital, and all the doctors and nurses are protecting themselves. So we did see quite a bit of transmission in hospitals in the early stages, but that was controlled, and that's how we got SARS under control in Hong Kong and also in other parts of the world that were affected. So two key properties. Most infections are severe, almost all infections are severe, in fact. And secondly, infectiousness is sometime after illness onset. For the new coronavirus, it's got two important differences. So it is still a coronavirus. It's similar to the SARS coronavirus. Also, it came from bats originally. But the two key differences are that for the new coronavirus, most infections are mild, not requiring hospitalization. And secondly, infectiousness seems to be highest around the time of symptom onset, which means for the new coronavirus, unlike SARS, we can have infected people maybe with mild symptom like a mild fever, a sore throat, a tickle in the throat, a cough. They can take a paracetamol, go to work as normal, and potentially infect other people in the community before they've even realized, that anything's wrong, because it can easily be confused with lots of other illnesses. So I think the new coronavirus is going to be much more difficult to contain and much more difficult to control than SARS. And SARS was difficult, but the new coronavirus is very, very different in those two important regards. And I think that's going to be really a challenge.
So one of the questions then I have based on that, from SARS, again, maybe this is explained by the difference, but my understanding from talking to many of the colleagues here or people who were living in Hong Kong, SARS, by the time the weather warmed up, later on when it's, by April and May, SARS kind of very much went away.
Yep.
And that was the end of it. But if we look at Singapore, which has more cases, and Singapore is a very hot place, but the number have not decreased at all. So I guess that the difference between that, again, going back to what you said about the difference between SARS and the virus, it is different.
Well, so SARS was also able to spread in Singapore, even when it was hot and humid. So we know that some of these respiratory viruses, particularly flu, prefers to spread when it's colder and drier, but it's not an essential characteristic, essential property. They can still spread when it's warm. And for the new coronavirus, I don't think we understand yet whether the hot weather would reduce transmission. But I mean, given that we've seen clusters of infections in Singapore already, we have the fear that hot weather may not stop it.
Okay. I now would like to ask about the all-important mask question. I have masks. I'm carrying it. We both decide not to wear it. My colleagues in the rooms are wearing it. So the mask question is something that I would, we are hearing about the shortage of masks here in Hong Kong, and not just in Hong Kong, but there is going to be a global shortage, especially in light of China's needs and everywhere else in the world also needing masks. So what is your advice on the mask? Are we overreacting on the mask situation? Or what, your personal opinion on some of this?
So I think there's very good evidence that when people are ill, if they wear a mask, it can protect others around them. And if we're caring for a family member who's sick, we can wear a mask to protect ourselves. We also believe that wearing a mask in the general community could reduce our risk of infection, but there's much less evidence that that's the case. And certainly if we wear the same mask for a very long time, it's going to lose its effectiveness. So given that we have a limited number of masks, I think in the coming days or weeks as a community, we need to have some discussions and some serious thought about what's the best way to use the limited amount of masks that we do have. So for myself, I've got a box of masks at home, but when those run out, I'm not sure that I'll be able to get more. So I'm currently thinking I'm going to save my masks for, when I'm going to a crowded area, maybe when I'm going shopping, when I'm expecting to spend a little bit more time in a group of people that I don't know, but maybe not wearing the mask in my office when it's around the same people every day, and not wearing the mask in my home with my family.
And right now, I think there has been an overwhelming support from the community to donate masks. And sometime, in fact, earlier we were just talking about donating masks to medical professionals. But you had a very good point about who really needs it right now. So if we are talking about donation, who are some of the community that we might be able to think about donating
so I mean,
to?
we've seen with the new coronavirus that the most vulnerable to severe infection are the older people, older adults, and people with underlying medical conditions. So, I mean, I would say if we're thinking of donating masks to anyone, then those would be the highest priority. I think for medical professionals, they have specific requirements about the kind of mask that they're required to wear when they're in the hospital and interacting with patients. So, I think for our own masks, if we like to donate them, then probably the vulnerable older adults and then, those kind of groups would really value.
I think that's really interesting. Great advice. And we will have information on that, hopefully on our website. And I know SCMP has also listed some of the community and elderly center who might be needing these masks. And we will work on that. I think since a lot of us are not working, those of us here at Asia Society, we are working in terms of putting programs like this. But those of you who are out there thinking about doing something for the community, we would certainly encourage you to think about all the vulnerable community who are needing it, especially the elderly. So stay tuned. You're going to hear more about things that Asia Society will be doing on that front. But in terms of what are you currently looking in terms of the kind of the milestones that you are looking at. I want to ask, I mean, like a lot of people are concerned about the end, and in some ways you kind of answered it previously, but how long do you think this epidemic is going to last? And what are some of the milestones that you're going to be looking for that will kind of help us see the light at the end of the tunnel?
Got it. So I've got really two critical questions that I'm now working hard to answer, hopefully as soon as possible. The first one is about the severity profile of infections, the average severity profile. So we know that this coronavirus is able to cause very severe disease in older adults and people with underlying conditions. We've seen quite a number of deaths in older adults. We've also seen some deaths in younger adults, including healthy younger adults like Dr. Lee, the famous case in Wuhan. What we don't understand at the moment is how many mild cases there are for these severe cases. So we know that there's a lot of mild cases. We know from the cases in Hong Kong and Singapore and elsewhere in the world, many coronavirus infections can be quite mild, just fever and some other mild respiratory symptoms. What we don't have a good measure of at the moment is how many mild cases are there for every severe case with pneumonia. Is it 10 mild cases for every one severe case, or is it 100 mild cases for every severe case, or somewhere between those two? If we can pin that down, it would really help a lot in order for us to judge, what kind of measures would be appropriate to sustain, which kind of measures could be reduced. When we think about measures that were taken in SARS, there are a lot of drastic measures. When we think about measures that are taken in typical flu seasons, we do take measures in Hong Kong, but not as drastic. We kind of tune them according to the potential impact of, local transmission of an infection. That's the first question. Second question is, can children be infected and can they infect others? We really haven't seen enough evidence of whether this is the case or not from information from whether it's China or even other parts of the world. We know that there's been some infections in children, maybe about 1% of the cases reported from China, and that does include some severe cases in children. But in general, our understanding is most likely there's a lot of mild infections in children. Maybe their immunity is better in some way to fight off this coronavirus, so they just get mild symptoms. But if the children can get it, and if they can also spread it in the community, then a measure like school closures that Hong Kong's currently doing, is kind of a very proactive measure. Then that would really be an important thing to keep if we want to, really suppress transmission in the community. If we were to reopen schools and then have a surge in cases, unless we were confident that, by and large, most infections are really quite mild and it's like a flu season, so we just need to prepare and protect the vulnerable people. I think that's really the two questions we need to sort out.
Well, then this is a question from the public talking about the coronavirus versus the flu. What are the differences, I think, in terms of the mortality and routes of transmission and prevention and so on?
So we don't fully understand the routes of transmission of the coronavirus, but we presume they're similar to flu, which means they can spread through prolonged close contact with respiratory droplets from breathing and from coughing. We think that the coronavirus can also survive on surfaces for a period of time. We don't know how long, but we suspect that environmental route might also be a way in which the coronavirus can spread. And so that makes it a little bit more difficult to know what to avoid, because we don't only avoid crowded places, we also avoid touching things that other people might have touched. And then we're also careful to wash our hands as often as possible. In terms of the similarities and differences with flu, it's a slower disease process than flu. Flu has a very short incubation period and a very quick transmission cycle. The coronavirus is longer, so flu is like 2 or 3 days from when someone's infected to when they pass on infection to the next person. Coronavirus more like 6 days maybe. So it's a longer cycle. Otherwise there's actually quite a number of similarities in terms of the kind of disease that can be caused. But we do think at the moment that the new coronavirus is causing more severe illnesses than flu. For example, we've seen a number of healthcare workers succumb to illness, and it's just reported today that a number have died. That's unusual to see healthcare workers die of influenza. So, that gives us a signal, an indication that this virus is a little bit nastier, a little bit more, a little bit more severe on average than influenza. And we should probably be a little bit more careful in terms of community measures and trying to slow down transmission.
This is also another question from the Facebook Live. It seems like every year we see new strains of kind of coronavirus like SARS, MERS. Is this inevitable? And if so, when do you guess the next one will be? I mean, is this something we have to expect every year?
Yeah. So when SARS came in 2003 and then we were able to contain it, we didn't really see SARS again after that. We know there's other viruses, coronaviruses like SARS in bats, but maybe didn't have a chance to spread to humans. I think if we could minimize the chance for bat viruses to infect humans, then we could, stave off more of these from coming. But as long as, we have wild animals being sold for meat in wet markets in China, there's always going to be a risk that one of them might have had an infection of one of these kind of coronaviruses that then has a chance to spread into humans. For MERS, it's a little bit different because that's a virus in camels in the Middle East. And camels are really, one of the few animals that can survive in the desert in the Middle East. They're really valuable animals. And so it's difficult to see how we could eliminate MERS from the camels in the Middle East. And then from time to time, that means we're going to see occasional infections of humans. But MERS doesn't seem to have the same capacity to spread from person to person as the new coronavirus does. So MERS outbreaks tend to be, there's an outbreak like there was of SARS, maybe in a hospital, and then it's identified and it's got under control. And then that's, it's a relatively smaller outbreaks from time to time.
I had previously asked you a question about the pandemic question. It's now, when will is it likely that the coronavirus, will become a pandemic?
Yeah. So it's too early to say. I think we would call it a pandemic if we were confident that there's ongoing transmission of the coronavirus in different parts of the world. So we've seen now that there has been ongoing transmission in Wuhan, perhaps also in some other parts of China, although that's less clear. Not yet in Singapore and Hong Kong, although we've seen some chains of transmission. Once we've identified the chain of transmission, we've been able to cut out further infections. So we've broken the chains of transmission. But I can imagine that this coronavirus is going to be very difficult to contain. We don't know a lot about whether there's infection spreading in other places in Asia. We imagine that some countries in the region should have had infected persons traveling there, maybe not detected. There's still a question about whether those have been able to spread infection and whether there's any chains of transmission. I think it's too early to say whether it's going to be a pandemic, but certainly if we heard reports that there was transmission going on in other continents outside Asia, then I think the WHO would start to think about whether to call it a pandemic.
I think this is another question from the Facebook Live audience. We talked about the transmission by bats and so on and so forth. So we don't have live bats. We don't sell live bats or snakes here in Hong Kong's wet market. Yep. But would it be advisable to steer clear here of our wet market with the live chickens and so on?
There's very few live chickens in wet markets in Hong Kong nowadays because of the fear of avian flu. I think there's no reason to steer clear of wet markets because of the fear of infection from animals. But of course, wet markets are crowded places that in general we'll tend to avoid at the moment, just like we avoid other crowded places, crowded indoor places.
This is an interesting question that a while ago, I think reading, if you're in a diet craze, turmeric was everybody's answer to a lot of illnesses. This particular one is asking about curry. Again, I'm curious to hear from your expert opinion. This question says, I read 7,000 Indians in Wuhan at this time have zero infections. And the suggestion is due to curry diet. Same claim during SARS, and I don't know if that's true or not, but science proved that curry powder equals is an antiseptic. Do you agree?
Well, so as a scientist, I would say that's an interesting hypothesis, and then it's something that could be examined or even tested in the future. I don't think there's any evidence that that's the reason why there aren't cases in Indians in Wuhan, if indeed it's true that there aren't cases in Indians in Wuhan. But I mean, certainly, all suggestions are welcome for how we can reduce the chance of infection with this coronavirus and how we can get on top of it.
This question is about flying. And right now, I think many of the flights, especially the U.S. airlines, have kind of canceled flight to Hong Kong, but flights are still going out of Hong Kong, to and from Hong Kong. This particular question is about a 2-year-old. If 2-year-old does not want to wear a mask on the plane, is that dangerous, or should the 2-year-old be grounded and not be flying?
I think at the moment and in the past couple of weeks, we've heard of very few cases on aeroplanes. Very few infected people that are known to have flown. Of course, there's some, and that's how we've identified the travel-related cases. But if you think about how many flights depart Hong Kong every day and how many, have been reported that there might have been an infected person on board, it's really a very small number. So I don't think that should be a major issue.
This particular question is about transmission with pet transmission from pets and also human transmission to the pets. Is that a possibility? And
yes, I don't know the answer to that. I mean, we know that this coronavirus originally came from bats, and we presume that it infected a small wild animal. The candidates, there's pangolins been mentioned recently, but before that, bamboo rats, badgers, hedgehogs, all of those kind of things. So those animals, in theory, are susceptible to infection. Dogs and cats, I'm not sure, maybe. But I mean, I don't think there's any evidence that that's happened so far. And I mean, let's keep our eyes out for that. Okay.
Let's see. The question about the apartment pipes, we've been hearing a lot about. I think this question is very similar to what happened in SARS. Some of the transmission has been through pipes. So can you address that? Is it what can we do to prevent this?
So there's two aspects to that particular incident in Hong Kong, which I think both are still under investigation. The first is whether the coronavirus can spread through the fecal-oral route, meaning if someone's infected, we know the coronavirus can, in theory, infect the gastrointestinal tract. And so in theory, could be spread through the fecal-oral route. Whether it is spread that way or not, we don't know. And the second issue is about that particular apartment with the pipes and the plumbing, and whether one person was able to spread infection to others because of the faulty pipes. I think that investigation is still underway. It's certainly perhaps the most likely explanation, but we also could imagine other possible explanations, like they met in the lift, or there was some contaminated areas somewhere else in the apartment block, which were the reason for the transmission. So I guess let's wait to see the results of that particular investigation.
This other question asks, does travel ban work?
Sure. So when we think about whether interventions work or not, we need to think about what was the rationale and what was the objective of that kind of measure. The travel reductions, whether it's bans or just reductions, the objective of that is to reduce the number of potentially infected people traveling from an affected area to an unaffected area. For example, to reduce the number of people infected in Wuhan from coming to Hong Kong or to Singapore or to the United States. So those travel reductions have clearly worked. They've clearly reduced the numbers of infected people traveling. But we know from years and years of research that these kind of travel measures can't completely stop infected people from going from one place to another place. So for example, for Hong Kong, even if we were to close the border with China, we wouldn't guarantee that we couldn't have an infected person coming in. And maybe we delay the chance of having some clusters of cases or some transmission of infection in Hong Kong, but we could never completely prevent it with that kind of measure. We could only delay it and maybe slow down because we reduce the pressure, reduce the numbers of infected persons potentially.
This question asks, in Hong Kong, how likely is it for a person to be in close contact with a coronavirus carrier? Say you're standing next to a person at a MTR or a bar. Yep. So 1 in 5, what is the percentage? How likely?
So two responses. Firstly, there's very, very few people known to have coronavirus infection in Hong Kong, and all of the people that we know to have infection are in isolation until they recover. So, perhaps there's a handful of people in the community that haven't yet been recognized, but I don't think there's going to be a large number of unrecognized people in a city of 7 million. That means it's a minimal risk. Second issue, I mentioned at the beginning that in Wuhan, in the early stage of the outbreak, each infected person was transmitting on average to 2 other people. So that's called a reproductive number, and it's an important measure of how contagious an infection is. So that's 2. Measles is a highly contagious infection where that number, the equivalent number, is 16 or even more. So one person can really infect a lot of people just with transient passing contacts. We think with the coronavirus, most likely it's spreading more through prolonged close contact. We've seen a lot of transmission within families. So I don't think if you were standing next to someone, you'd have a very high chance of infection if they did have the coronavirus. So most likely they wouldn't. And even if they did, you'd have a low chance of acquiring infection because it really requires most likely prolonged close contact.
This question asks, what's your view on whether asymptomatic people can be carriers or super spreaders of the COVID-19? I've read conflicting accounts with no final resolution.
Yeah. Okay. So the current understanding of asymptomatic infection, there's certainly some people when they're tested, maybe some people who've been exposed to other cases, when they're tested, they can show a positive result on the test before they show symptoms. So it's not exactly asymptomatic, it's actually called pre-symptomatic. And we do think that there's some potential for people to be able to be detected to have the virus before their symptoms show. And that's in a number of cases that's been reported. There's a very small number so far, to my knowledge, a very small number of people who have had almost no symptoms whatsoever with coronavirus infection. So not only did they show viral shedding without symptoms, but they didn't go on to develop symptoms. But I know that the Chinese government changed the reporting criteria a few days ago to exclude asymptomatic infections. Actually, it's made a minimal difference because there's really a very, very tiny fraction of known cases who are totally asymptomatic. But then I would come back to my question earlier about children, about whether it's possible for children to have milder illness, maybe, just some respiratory symptoms, a mild fever, and also be contagious. We don't know whether that's the case or not. We suspect it might be because we know in general children are, one of the important groups for spreading respiratory viruses around the community. But then again, because we haven't seen children among the confirmed cases very often, maybe they're not.
This is another question. Do you recommend offices purchasing IQ Air purifiers for the safety of colleagues? Would that help?
I think for large office spaces, you need some really heavy duty air purifiers to get the flow rate to really purify out the air. And I'm not sure what's the evidence for those purifiers really reducing the risk of transmission, given that what we know about transmission is that it's most likely prolonged close contact. So unless you're having prolonged close contact next to the purifier, I don't know whether the purifier would help a lot. But then again, maybe we take every measure possible to try to prevent transmission in offices and in other places. So certainly, can consider.
This question asks, can a person test negative and later test positive for COVID-19?
Yeah, that's happened many times. And there's a number of reasons for that. So the first reason is a technical reason that when we collect a sample, need to be collected in the right way, sent to the lab in the right way, and tested in the lab in the right way. And if any of those steps goes wrong for some reason, then we may get a negative result when it should have been positive. The second reason is biological, that some patients seem to be infected first in the lungs, where it's very difficult to get a good sample, and it's only later that the infection spreads even up to their, the nose and the throat, where we typically get samples for testing. So we know a number of cases outside of China where the first test, the second test is negative, and then eventually there's a positive test result. So it's certainly possible that one test could show negative when the patient actually does have the coronavirus infection.
This question asks the approaches, asking you whether you know the approaches taken by the Singapore government versus the Hong Kong government. They're significantly different. Wondering if you can comment on both approaches.
So there's a little bit of difference. One of the most notable ones is the school closures, where Singapore schools are still open, but there's advice to reduce some of the extracurricular activities, I understand. But in both Hong Kong and Singapore, there's very aggressive measures to identify cases of infection, to isolate them and to quarantine their close contacts. And I think that's a good idea at this stage of the epidemic. For a measure like school closures, we really need to establish what's the importance of children. So I wouldn't like to say which approach was better. Certainly, we can buy time to figure out what's the best measures to use in both places, and I guess we'll probably look at what each other's doing, to try and do as well as possible in controlling this outbreak.
This question asks, with Chinese factories reopening, would we worry about a wider spread as factory workers now move around and social distancing is no longer a practice.
Yeah, so I mean, let's be very clear that social distancing measures should work in reducing transmission for as long as they are in place. But if the social distancing measures are removed and life goes back to normal, then we expect the potential for transmission again. So if there are some parts of China or elsewhere in the world where factories were closed and then factories reopen, people start working in enclosed spaces, in crowded areas again, and there are infected people in the community, then we would expect transmission to potentially occur. We do work in factories, people work in factories in flu seasons, and there's flu outbreaks in factories, and people have sick days and so on. I think I go back to my critical question on the severity profile, that if this is typically a mild infection, then factories reopen, some of the staff may have mild infections and then get back to work, and there's nothing so much to worry about. But the concern of many of us at the moment is that this infection seems to be a little bit nastier than flu, so we want to take more measures to stop transmission in the community and to protect everybody's health, not only the people who work in factories, but family members, older adults, who we would prefer to prevent being infected if at all possible.
So in some ways, I heard recently that a major conference in Barcelona was the Telecom conference was canceled or postponed because of the unknown. So that is
I think we're going to see a lot of this. I think we're going to see a lot of this. So we've seen other events cancelled in Hong Kong and Singapore and other places, and I think we're going to see more of this as time goes on, because those kind of conferences are places where infections could really spread quite quickly, because there's so many people in very crowded settings. And one of the main measures that we'd like to recommend is to avoid crowded areas and to reduce social mixing as much as possible.
This question, am I at risk for coronavirus from a packaged product shipped from China?
No, so I don't think that's a risk. So our understanding is that the virus can survive a short time on maybe some surfaces, but on packaged products, I doubt there'd be an issue with contamination.
Okay. I think we're getting closer to, we have 10 more minutes. And what are some of the general advice that you would also now give to people? I know now that mask is not wearing it is not an essential, washing hands, but what other kind of advice that you can give about whether it's traveling? You also mentioned that the traveling on the airline is actually not, there's no cases of transmission through it. So what are some of the general advice that you can give to Hong Kong and just people who are worried about all of these unknowns? And also part of it is, for me, it's also the psychological. I mean, people are trapped at home for this from now until in the case of Hong Kong, school is closed till middle of March. Advice not to work from home is continued, but the government side end of February. So
I don't think we need to stay at home. I think we can go outdoors. There's a lot of lovely countryside in Hong Kong. Our understanding of transmission is that it's mostly occurring in prolonged close contact, mostly indoors. Outdoors, there's a breeze, there's a sunlight, all of which will really act against transmission. And anyway, if we're in the countryside, there's a lot of space between people. We're not generally crowded. So we don't need to stay at home, but certainly we can reduce our risk of infection. If there is infections in the community in the future, we can reduce our risk by staying at home more, by avoiding crowded areas, by washing our hands more frequently than we might normally do, particularly when we are coming home, and also be careful with our masks. So, don't wear the same mask for a long period of time. When you get home, take off your mask and throw it away and wash your hands. Don't take the mask that may have been contaminated into your home, because if the mask has been working, then it's protected you from infection, but it's itself contaminated. So then you want to be very careful with it, throw it away, and wash your hands.
Okay. This question is asking, are smokers at a higher risk?
Yeah, I don't know. So in SARS, there's some reports that smokers might have been at higher risk because of maybe damage to their lungs that made them more vulnerable to the pneumonia. I don't know. I haven't seen any evidence from the current outbreak about whether smokers are more or less vulnerable than non-smokers. In general, public health advice is to stop smoking.
One of this question is asking about vaccine. Is a lot of stuff is being tested, and there's also been talk of AIDS-related drugs. So are we coming close to some sort of breakthrough?
There's a lot of promising options for treatment. So there's some AIDS drugs, there's some other antiviral drugs which are being tested specifically against the coronavirus in China, and we're eagerly awaiting the results of those earliest clinical trials. There's another approach which is not using a drug, but using the blood from recovered patients who've developed antibodies. So get their blood, their antibodies, and give it to the patients that are currently in hospital and maybe help them to recover more quickly. So again, that should probably be tested. In terms of vaccines, that's a longer time cycle. So I guess we'll know more about treatments within the next few weeks and then months. But for vaccines, it's really a timescale of years, not months. There's a few possible approaches which are already being tested out in the very initial stages in laboratories, but there's a lot of steps involved before we can get a vaccine that can be widely used. We need to test it in the laboratory, then it needs to be tested on some animals, and we need to figure out which animals will be the best ones to test with first, and then we need to test in humans to make sure it's safe, and then we need to test in humans to make sure that it can give some kind of protection, and then only after we've done all of those things, then we can talk about manufacturing in larger quantities and using it more widely. So we're talking about years, I would guess, not months for vaccine.
And do you see possible collaborations? Is that an area in terms of companies from the U.S., China?
Sure. I think a lot of companies around the world have been working on vaccines for other diseases and now thinking about whether their technologies could be adapted to add in the coronavirus bits instead of the other virus bits that they were working on before. And then there's massive opportunities for companies to work together to compare their approaches and figure out as quickly as possible what are the best ways, the best potential ways to develop a vaccine that works.
So I guess this is going to be my last question to you in terms of what is really kind of keeping you up at night? What are your number one worry right now in terms of this virus?
So I'm just worried that we haven't been able to contain the spread in China, and that I have cold sweats about whether we're suddenly going to discover that it's been spreading in another part of the world that we didn't realize, and suddenly there's quite a number of infections. And then all of the efforts that have been made in China, all the efforts in Hong Kong and Singapore, they're going to have to, if my fear is true, they're going to have to continue for a while, because we're not only going to have to worry about infected people coming across the border or from Singapore or from Thailand, but maybe from other parts of the world as well. And so, sooner or later, we're going to have to face that, there's going to be more transmission in the community than there is currently. And then how do we really keep that as low as possible while at the same time trying to get on with our lives?
And is there another question that I want to ask is really about the mask alternatives? Right now, there's a lot of interesting questions about different type of masks. If they're not surgical masks, is there any other things that can't be replaced? Can replace masks in terms of?
In terms of the scientific evidence, the only type of mask which there's evidence for is then surgical mask. And then, of course, the really high protection type of masks which are used in healthcare settings or in factories to protect against really fine particles. There's no evidence to my knowledge that things like scarves or gauze or whatever could reduce the risk of infection with a virus like the coronavirus. I mean, having said that, if we don't have surgical masks, then we can still think about, covering our mouths with a scarf, but there's no evidence that would be effective. Surgical masks are designed very specifically, to stop the spread of pathogens, including perhaps viruses. So that's why the surgical masks are in such high demand at the moment.
This question is also coming from in mainland China, except for Hubei, number of daily new confirmed cases is decreasing. Does that mean the coronavirus turning point has arrived?
Yeah, I mean, that's really good news. It looks like those other cities have taken quite drastic actions to slow down transmission and to reduce the chance of infection. But as I said earlier, those kind of social distancing measures, locking down cities, will be effective in reducing transmission. But if there's infected persons when those measures are lifted, then we'll see the transmission come back up again, most likely. So, the measures are effective, they're working, But unless we can get it down to zero, like we did for SARS, then I think we need to think carefully about how we're going to continuously reduce transmission and try to prevent transmission as much as possible.
This question asks, does China keep track of the number of fatalities outside those confirmed? Trends in these numbers will provide further clues for understanding the severity.
Yes, I'm not aware that they're being tracked as part of the response to the coronavirus outbreak, but of course, as time goes on, it'll be possible for researchers in China to go and look at the mortality records in different places because, China, just like everywhere else, has very careful records of births and deaths. And so tracking the number of deaths, maybe they'll see spikes in Wuhan in January or February, which can just be discerned from, more deaths than there would have otherwise been in other years. And that would give another way of establishing what the full impact of coronavirus has been so far.
This question, I think, is pretty until when would it be safe to attend a conference in Hong Kong and mainland China?
I think for now, our recommendation as scientists would be to avoid crowded places, and that means avoiding conferences. In the future, I don't know how long the current situation will last for. Maybe we can think of ways to have conferences that don't require such a lot of people in small spaces. But I can't give a time scale.
I think we are coming toward the end. And I think I'm going to, your advice about getting people out there in open space is something that I want to echo. Asia Society, I just want to remind those who are watching this, we have chosen to open Asia Society Hong Kong Center because of our outdoor space. Although the gallery is closed right now for our next installation of next exhibition, and we are announcing perhaps a delay in the opening because of the confined spaces, but the outdoor space is open. And so I'm really delighted to present Professor Cowling this catalog of our last exhibition a couple of years ago on contemporary art from Hong Kong, breathing space. Mm. And this is a way of kind of reminding us we all need breathing space, and whether it's psychological, physical, or whatever. I think going outside, and whether it's on hikes or come and visit our center, I do still feel like we are social beings, and there are other ways of interacting, whether through Facebook Live. We're going to be doing more of these type of events. In fact, I think there's one next week, and we will be keeping up with the technology. And like you said, I think conferences, certain events can still be done online and through the use of technology. So please stay with us, and we look forward to welcome you back for the episode 2 on coronavirus from Hong Kong and beyond. Thank you.
Thank you.
Thank you, Professor Cowling.
Thank you very much.
Enjoy, and something you can read while you're indoor in your office or at home.
Thank you very much.
Thank you so much. Thank you.